So, good morning, everyone. I'm Marva Williams, and I'm a scholar in residence at the Public Health Management Corporation. And I'd like to thank all of you for participating in this presentation on a subject that's very near and dear to my heart, the myths of poverty. I believe that it's very important to identify and address these myths in order to have honest conversations about poverty alleviation. In addition to that, I'll also be covering some of the theories of poverty and how it occurs. And you'll see the connections between the myths and the theories of poverty. So the first myth is all you need to do is to work hard. There's a sense of justice and fairness in our country, and that hard work is all you need to do in order to move out of poverty. However, what we found is that hard work is necessary, but it's not a sufficient condition for getting out of poverty. One third of the poor actually work full time year round. Um, and of the people who are not elderly, one fifth of those at the bottom of the income ladder, their income comes from wages. And so many of the poor are working part time and are working very hard. And unfortunately, our economic system has changed, and there are now more low wage jobs and jobs that do not provide benefits. In addition to that, because of the service economy, it's difficult for people to work consistently and to work full time. There's a disincentive amongst employers to provide full time employment because of the necessity of providing benefits for full time employees. So, the second myth is that poverty is inevitable, that there's really nothing we can do about it. However, we saw in the 1960s that the war on poverty reduced the poverty by over 11% from 1959 to 1973. We've also seen that the Social Security has reduced poverty amongst the elderly. Single female headed households have had a poverty rate of over 35% in the United States. But when we compare that to Scandinavian or Nordic countries, we see that due to their pro-children and pro-family policies, that their poverty rates are only 6%. So poverty is not inevitable, that there are policies and programs that can help to reduce poverty. The other myth is that the poor in the US are better off than the poor living elsewhere. And when you look at developed countries, this is not necessarily true. The poverty rate in the US in the late 1940s was 69% of median family income for a family of four. However, now that poverty rate is only 25% of the median income for a family of four. When you look at countries that are developed, the US has the highest rate of poverty, particularly for families and children. And poverty in the US causes a number of different challenges, including food insecurity, unattended health problems, incarceration, discrimination, being victimized by crime, and the use of high cost predatory loans. In addition, the use of the safety net program is stigmatized in the US. There is a tendency to look down on people who may use these programs. And in addition to that, people who are living in segregated communities, and the US residential patterns are extremely segregated. People who live in these segregated communities, lower income communities, also are experience much higher levels of stress and anxiety and social exclusion. The next myth is that the welfare state in the United States is enormous. However, when you look at safety net programs with the exclusion of healthcare, the rate is only 2% of the GDP. And although the US has much higher rates of poverty, as I said before, than other developed countries, we actually invest less in these programs than other developed countries. The level of spending on poverty has actually decreased from 8,700 for families in 1990 to only 7,000 in 2015. And those numbers are um, adjusted for inflation. Welfare reform has also resulted in far fewer families receiving assistance. In 1979, before welfare reform, 82 of 100 families with children in poverty received welfare assistance. And unfortunately, by 2017, that's only 23 of 100 low-income families with children. So the belief in the United States is the poor don't really need safety net programs, that they can live without them, that if they work hard, that they can alleviate their poverty. And much of this stigmatization is due to racial discrimination, which also impacts the perceptions of government assistance. The next myth is that welfare fraud is common, and this is perpetuated by policymakers beginning in the 1980s, but continuing now. There are many unfounded concerns about safety net fraud. Less than 1% of retailers who accept SNAP or food assistance, federal benefits, were disqualified due to trafficking. There's also a misrepresentation of the amount of money that may be overpaid to people. When you look at the fraud losses for TANF and safety net programs, it's actually 1/10 of 1%. However, when one looks at fraud due to tax evasion, that's actually $1 in $6. So there is a much higher rate of fraud when it comes to tax payments than when it comes to safety net programs. Safety net recipients also have to comply with a number of tests that can be very stigmatizing, including drug tests, fingerprinting, and this really discourages people from applying for assistance. However, there is one caveat that SNAP recipients have a slightly higher rate of drug use than other residents. And then there is a myth that government programs can't reduce poverty. However, we've seen that Social Security has reduced poverty amongst the elderly, that poverty rates are being cut in the US due to safety net programs, and that other developed countries, particularly in Scandinavia, have cut their poverty rates by as much as 75% through safety net programs. So I'd like to move on now to the myths of poverty. There are behavioral theories, structural theories, and political theories. And one interesting aspect of all of these theories is that there is an integral role of the behavior of lower income people in causing poverty. So let's move on to the first theory. This theory, the behavioral theory, is the most simplistic of all the theories of poverty. And basically, it posits that due to incentives, and that's the availability of safety net programs and the culture of poverty, that this impacts the behavior of lower income people and causes them to move into poverty. And then there's a feedback loop where poverty plays a role in the availability of incentives and also culture. So as you can see here, the behavior of lower income people is seen to be a major cause of poverty. Structural theories also look at behavior, but in a broader manner. So it looks at the economic context of a society and how that might change behavior. So economic context might include depressions and recessions, changes in economy, inflation, job availability, job wages, and other economic contexts that may change behavior and that may cause poverty. And then there's the demographic context. So this looks at people of color and women-headed households and how that not only changes behavior, but also may actually cause poverty. The last theory looks at the importance of politics in the alleviation and causes of poverty. And so, not only is behavior one of the major causes of poverty, but you're also looking at institutions, particularly government institutions and political power, and how that impacts the kinds of policies that are established. And then those policies may cause poverty or may alleviate poverty, but then behavior is also a major contributor to the cause of poverty. And as you can see here, when we looked at the myths of poverty, most of those myths were addressed the behavior of lower income people. But there was also some emphasis on the institutions which may cause or policies that may provide an incentive for lower income people to remain poor or to not pull themselves up by their bootstraps. So this last chart looks at some of the causal relationships of poverty, looking at all three of the theories of poverty. So when looking at behavioral theories, the major question is how much of poverty behavior is beyond the control of individuals. And so this is considering things like the economy, demographic information, educational attainment, and other very material challenges that lower income people face. When looking at structural theories, the major question is how much can governments moderate demographic and labor market change? So we've seen this recently in the discussion about inflation in the US and particularly the um, amount of control or level of control that government institutions may play in alleviating poverty. And then last, in terms of political theories, the question is how much can governments moderate the behavioral poverty link? And are there ways of providing incentives to individuals as well as programs that do not stigmatize people or that may actually provide enough assistance to bring them out of poverty? So these are the major references for this presentation. I'd like to thank you all for participating in the presentation and wanted to mention that there is a very important role for advocates when it comes to poverty alleviation. First of all, in addressing these myths of poverty, and understanding sort of the complexity of poverty, that it's not a simple issue that will require simple policies, but a very complex issue that is grounded in our economy, in our demographics, in our politics, and also the way um, people in the United States sort of consider our country as a level playing field. And so the level of advocacy and citizen participation and community organizing, I think, is a really important tool to alleviating poverty.